Have you ever found yourself lying awake at night, your mind racing with worries about work, relationships, or life changes? Maybe you're staring at the ceiling, replaying conversations from earlier in the day, or thinking about all the things you need to do tomorrow. Perhaps you notice your heart beating a little faster, or you feel a knot in your stomach that just won't go away. These moments are familiar to many of us, and they can leave us feeling exhausted, frustrated, and even a bit helpless. It's in these quiet hours when the world is still that our worries can seem the loudest. You might wonder, is this just stress, or could it be anxiety? It's a question that comes up often, and it's not always easy to answer. The feelings can overlap, and sometimes it's hard to tell where one ends and the other begins. But understanding the difference is important, because it can help you take the right steps to feel better and regain control over your life. I am Dr. Naim, a consultant psychiatrist at BritMed London. Over the years, I've worked with countless individuals who have struggled to distinguish between stress and anxiety. It's a common challenge, and it's one that can have a big impact on your mental health, your relationships, and your overall quality of life. Today, I want to share my expertise and experience with you so you can better understand what you're feeling and know what to do next. Today, I will help you understand the key differences between stress and anxiety, when normal worry becomes something more, and how to know when it is time to seek help. We'll talk about the signs and symptoms, the causes, and the ways you can manage these feelings. Whether you're dealing with a tough week at work, going through a major life change, or feeling overwhelmed for reasons you can't quite explain, this information is for you. Let us start with stress. Stress is something we all experience from time to time. It's a natural part of life, and in some cases, it can even be helpful. Stress is your body's way of responding to challenges or demands. It's what helps you meet deadlines, prepare for important events, or react quickly in dangerous situations. In small doses, stress can motivate you to perform at your best. But when stress becomes overwhelming or lasts for too long, it can start to take a toll on your mind and body. Stress is a response to an external trigger. This means that something outside of you, like a looming deadline, a difficult conversation, or a sudden change, sets off your stress response. Your body releases hormones like adrenaline and cortisol, which prepare you to deal with the challenge. You might notice your heart beating faster, your muscles tensing up, or your mind racing with thoughts about what you need to do next. These physical and mental changes are designed to help you cope with the situation at hand. It might be a tight deadline at work, a family conflict, or a big life event like moving house or starting a new job. Even positive changes like getting married or having a baby can be sources of stress. The key thing to remember is that stress is usually linked to a specific situation or event. You can often point to the cause and say, "That's what's making me feel this way." Stress is usually time-limited, and once the situation resolves, the stress fades away. For example, after you finish a big project at work, have that difficult conversation, or settle into your new home, you'll likely notice your stress levels drop. Your body and mind return to their normal state, and you feel a sense of relief. This is a healthy, adaptive response, and it shows that your stress system is working as it should. Anxiety, on the other hand, is more persistent. Unlike stress, which is tied to a specific event or situation, anxiety can linger long after the trigger is gone, or even appear when there's no obvious reason at all. Anxiety is an internal feeling, a sense of unease or dread that can be difficult to shake. It can creep into your thoughts at any time, making it hard to relax or enjoy the present moment. It is an internal feeling that often lingers, even when there is no clear reason. You might find yourself worrying about things that haven't happened yet, or imagining worst-case scenarios that seem unlikely. Anxiety can make you feel on edge, restless, or constantly alert, as if something bad is about to happen. This feeling can be hard to explain to others, and it can make you feel isolated or misunderstood. Anxiety can be disproportionate to the situation, and it may not go away, even after the trigger has passed. For example, you might continue to feel anxious long after a stressful event is over, or you might feel anxious about things that most people would consider minor or unimportant. This ongoing worry can interfere with your ability to focus, make decisions, or enjoy life. How can you tell the difference? It's not always easy, but there are some key signs to look for. With stress, you can usually identify the source of your feelings. You know what's causing your tension, and you can often see an end in sight. With anxiety, the worry can feel overwhelming, constant, and hard to control. It might seem like your mind is stuck in a loop, replaying the same fears over and over again. With stress, you might feel tense, irritable, or have trouble sleeping, but you can usually identify the source. You might notice that your mood improves once the stressful situation is resolved. You may feel tired or drained, but you're able to bounce back and return to your normal routine. Stress can also motivate you to take action, solve problems, or seek support from others. With anxiety, the worry can feel overwhelming, constant, and hard to control. You might find it difficult to relax, even when you're in a safe or comfortable environment. Anxiety can make you feel like you're always waiting for something bad to happen, even if there's no real threat. This sense of unease can affect every part of your life, from your work and relationships to your physical health. You may notice physical symptoms, such as a racing heart, sweating, shaking, stomach problems, or trouble breathing. These symptoms can be frightening, and they can make you worry that something is seriously wrong with your health. It's important to remember that anxiety can cause real physical sensations, even when there's no medical problem. These symptoms are your body's way of responding to perceived danger, even if the danger isn't real. There are different types of anxiety disorders. Each type has its own unique features, but they all share the common thread of excessive, persistent worry or fear. Understanding the different types can help you recognize what you're experiencing and seek the right kind of help. Generalized anxiety disorder involves excessive worry about everyday things. People with this condition often find it hard to control their worry, even when there's no clear reason to be anxious. They might worry about work, health, family, finances, or other aspects of daily life. This worry can be so intense that it interferes with their ability to function normally. Panic disorder is marked by sudden episodes of intense fear, called panic attacks. These attacks can come out of nowhere and cause symptoms like chest pain, shortness of breath, dizziness, or a feeling of impending doom. Panic attacks can be so distressing that people start to avoid situations where they fear an attack might happen. Social anxiety is a fear of being judged or embarrassed in social situations. People with social anxiety might avoid parties, meetings, or even everyday interactions because they're worried about what others will think of them. This fear can make it hard to form relationships, advance at work, or enjoy social activities. Health anxiety is an ongoing worry about your health, even when tests are normal. People with health anxiety might constantly check their bodies for signs of illness, search for symptoms online, or seek repeated reassurance from doctors. This worry can become all-consuming and make it difficult to focus on anything else. If you find that worry or anxiety is interfering with your work, relationships, or day-to-day life, it may be time to seek help. You don't have to struggle alone, and there are effective treatments available. Reaching out for support is the first step toward feeling better and regaining control over your life. At BritMed London, we offer private anxiety assessments that you can book online. Our team of experienced psychiatrists and therapists will work with you to understand your symptoms, identify the underlying causes, and develop a personalized treatment plan. We know that seeking help can feel daunting, but we're here to support you every step of the way. Treatment can make a real difference. Many people find that with the right support, they're able to manage their anxiety, reduce their symptoms, and get back to living the life they want. You don't have to let anxiety control you. Help is available, and recovery is possible. Cognitive behavioral therapy, or CBT, can help you manage anxious thoughts. CBT is a type of talking therapy that teaches you how to identify and challenge unhelpful thinking patterns, develop healthier coping strategies, and gradually face the situations that make you anxious. It's a practical, evidence-based approach that has helped millions of people around the world. Medication may be recommended in some cases. There are several types of medications that can help reduce anxiety symptoms, including antidepressants and anti-anxiety medications. Your doctor will work with you to find the right treatment for your needs and will monitor your progress to ensure you're getting the best possible care. Lifestyle changes, like regular exercise, healthy sleep, and mindfulness, can also help. Taking care of your body and mind is an important part of managing stress and anxiety. Simple habits like going for a walk, practicing deep breathing, or setting aside time to relax can make a big difference. It's also important to stay connected with friends and family and to make time for activities that bring you joy. Remember, seeking support is a sign of strength, not weakness. It takes courage to ask for help, and doing so can be the first step toward a happier, healthier life. Whether you talk to a friend, a family member, or a mental health professional, reaching out can help you feel less alone and more empowered to make positive changes. You are not alone, and help is available. Millions of people experience stress and anxiety, and there is no shame in seeking support. With the right help, you can learn to manage your symptoms, build resilience, and find peace of mind. For more information, or to book a private anxiety assessment, visit our clinic in London. Thank you for listening. Remember, understanding the difference between stress and anxiety is the first step toward taking control of your mental health. If you're struggling, don't hesitate to reach out. We're here to help you every step of the way.